Obstetrics and Gynecology, OBGYN, for 10th semester students of the Faculty of Medicine. Obstetrics and Gynecology is a branch of medicine focused on women's reproductive health, including pregnancy, childbirth, postpartum care, as well as the diagnosis and treatment of diseases related to the female reproductive system. Below is a comprehensive and structured explanation of various aspects of obstetrics and gynecology relevant to the 10th semester of medical school. 1. Pregnancy management. A. Management of normal pregnancy. 1. Antenatal care, ANC, primary functions, early detection of complications such as hypertension, gestational diabetes, and infections. Educating mothers about nutrition, physical activity, warning signs of pregnancy, and the importance of immunizations like tetanus toxoid vaccines. Increasing family involvement to support the mother's mental and physical well-being. Detailed clinical monitoring, blood pressure, early detection of hypertension or preeclampsia. Urinalysis. Proteinuria for preeclampsia detection, glucosuria for gestational diabetes. Fundal height measurement, monitoring fetal growth and detecting disorders like intrauterine growth restriction, IUGR. Ultrasound in each trimester. First trimester, determining gestational age, ectopic pregnancy, or chromosomal abnormalities using tests like NT-scan. Second trimester, assessing fetal anomalies, e.g., structural anomalies like spina bifida, placental location. Third trimester, determining fetal position, head presentation or breech, estimated fetal weight, and amniotic fluid volume. 2. Nutrition and pregnancy supplements. Macronutrients. Protein, supports fetal and placental tissue growth. Complex carbohydrates, serves as the primary energy source for the mother and fetus. Micronutrients. Iron, reduces the risk of anemia in the mother and baby. Folic acid, prevents neural tube defects in the fetus. Vitamin D and calcium, supports fetal bone and teeth development. Iodine, essential for fetal brain development and maternal thyroid function. 3. Common pregnancy complications. Hyperemesis gravidarum. Symptoms, excessive nausea and vomiting causing dehydration. Electrolyte imbalance and weight loss. Management, intravenous fluids, antiemetics, e.g., ondansetron, and vitamin B6 supplements. Torch infections, toxoplasmosis, rubella, CMV, herpes. Risks to fetus, hydrocephalus, microcephaly, blindness, and mental retardation. Diagnosis, serologic tests for IgM and Ig antibodies. Management, prophylaxis or treatment based on the infectious agent, e.g., spiramycin for toxoplasmosis. B. High-risk pregnancy management. 1. severe preeclampsia and eclampsia. Signs: severe headache, epigastric pain, visual disturbances, proteinuria greater than 300 mg 24 hours. Management: magnesium sulfate prevents seizures. Antihypertensives: labetalol, nifedipine, or hydralazine. Labor induction: performed at term or if the condition worsens. 2. Pregnancy with HIV. Management: triple antiretroviral therapy to prevent vertical transmission. Elective cesarean delivery if viral load is high or for other obstetric indications. 2. Labor management: a normal labor. 1. Preparation for labor: educating mothers about early signs of labor such as regular contractions, bloody show, and rupture of membranes. Internal examination to monitor cervical dilation. 2. Stages of labor. First stage. Duration: prima gravida, 8 to 12 hours, multigravida, 6 to 8 hours. Monitoring: uterine contractions, fetal heart rate every 30 minutes. Second stage. Management: guiding the mother to push during peak contractions. Monitoring: detecting signs of fetal asphyxia. Third stage. Active management: administration of oxytocin to prevent postpartum hemorrhage. B. Assisted delivery. 1. Cesarean section, C-section. Indications: placenta previa, severe preeclampsia, cephalopelvic disproportion. Technique: lower uterine segment incision to minimize hemorrhage complications. Complications: infection, deep vein thrombosis, and postoperative adhesions. 2. Vacuum or forceps delivery. Indications: maternal fatigue or fetal distress. Complications: neonatal head trauma, maternal birth canal lacerations. 3. Reproductive system diseases and gynecological diseases. 1. Reproductive tract infections. Pelvic inflammatory disease, PID, symptoms: pelvic pain, fever, abnormal vaginal discharge. Treatment: combination antibiotics like ceftriaxone and doxycycline. 2. Endometriosis. Symptoms: severe menstrual pain, infertility. Management: hormonal therapy, progestins, GnRH agonists. Laparoscopic surgery to remove endometriotic tissue. B. Reproductive cancers. 1. Cervical cancer. Screening: Pap smear every 3 years, HPV DNA testing. Treatment: conization for early stages. Radiotherapy and chemotherapy for advanced stages. 2. Ovarian cancer. Diagnosis: California 125 tumor marker. Transvaginal ultrasound. Management: debulking surgery, platinum-based chemotherapy. 4. Patient education. Pregnancy. Warning signs like bleeding, severe headache, or reduced fetal movements. Labor. Importance of birth planning and emergency preparations. Reproductive diseases, genital hygiene and the benefits of routine cancer screening.